Hello, I'm Sandra Fitzgerald and I'm one of the clinical editors with HealthPathways.
And I'm Jo Wood. I'm a GP and a clinical editor for HealthPathways. We're here to talk today about how HealthPathways has responded to the COVID-19 crisis and how it's going to be useful for general practitioners.
So Jo, how would you describe HealthPathways?
Well, it's a clinical tool for GPs and other people working in primary care that helps you to do an assessment of a patient, to manage them, and probably, arguably, one of the most important parts of it is to work out local referral pathways.
We liaise very closely with people in our local health district and local clinicians to make sure that we are taking national and state guidance and making it locally relevant for GPs and other primary care clinicians as well. Health Pathways have just introduced a whole new suite of pathways called COVID-19. The first one is practice preparation, and then we've got one that's around assessment and management, a whole page just on local referral information, an information page that's got lots of really useful links on it, and then still to come will be impact on local services, so how COVID-19 is affecting things like the outpatient clinics, the emergency departments, and inpatient services as well.
Yeah.
And there's one final other page there that's called recent changes, and on that page you will just find each day what we've changed on the pathway, so you don't have to go scouring through the whole pathway to see what's different from yesterday. As a GP, what do you find most useful around the assessment and management pathway?
I think that it's hard to pick out one thing, to be honest, because general practice is one of those typical can't predict a single thing settings, but I've used the pathway to double check on a patient's risk for COVID-19, so trying to keep track of the rapidly changing epidemiology for the COVID-19 situation has been exhausting. It's been like a fire hose of information, but the great thing about the pathway is that all of those guidelines have been channeled into one place, so that's picking out the stuff that I need to know when I'm seeing a patient, or ideally I'm triaging a patient over the phone to see if that patient is eligible for a swab and meeting the criteria. So I've been using it for the assessment part of it. The management section has been just useful trying to work out, where do I need to channel that person in terms of if I don't want to be doing the swab myself, who do I go to, that sort of thing. But I think as the situation develops, where the use for that pathway is going to come into for us as general practitioners is how are we going to manage these people in the community? How are we going to manage people in quarantine? How do we develop skills around telehealth? How do we navigate the rapidly changing environment with, we're hearing from somewhere that some medications are going to be causing harm, some medications are going to be beneficial. Is there actually any evidence for any of those things? How do I advise my patients, and how do I navigate that minefield, that fire hose of information that's coming at us?
And so the Health Pathway team are working pretty much around the clock. We're checking national guidance, state guidance. We're in constant communication with the Public Health Unit, and we've had New South Wales Health oversight over the pathway, just to make sure that what is on the page at any time is current and up to date, and we're able to make changes within a 20-minute, 30-minute space for things that urgently need to be updated. As a primary health clinician, or particularly GPs, we're hoping that you're going to find it really useful to be a one-stop shop and source of truth for information, and that you don't have to go looking in lots of different spots to find the information that you need.
Yeah, and just translating that information from different guidelines it's difficult. Like, it's not written for primary care, so we need to have someone that's sort of translating that and putting it into a real life situation and going, okay, actually what I need to know right now is X, Y, and Z. Another thing that I found very useful in my clinical practice is to be able to direct people to a reliable source of information, and the patient info site that's being maintained is a really great go-to, so I strongly encourage people to have a look at that.
That's our other source of truth. So we have two sources of truth. We've got Health Pathways for clinicians and patient info for your patients. We really rely on your feedback to let us know what's important for you in managing your patients. So if you can provide any succinct feedback that you have that will improve the pathway, on every page there's a little bubble that you can press to give that feedback. If you would like to get onto Health Pathways and you don't currently have access, just log on the URL on the screen and we will organise access for you. And probably the last thing we'd like to say is that this is really an unprecedented health event, and we all need to just bind together and support each other, and that's one of the driving forces for our Health Pathways team, is to do the best job we can to support all primary care clinicians. And so stay well, stay safe, and look after yourselves and care for each other.